Hey y'all, my name's Rebecca and I'm a senior in the social work department in the University of North Carolina at Greensboro. I'm working with my mentor, Professor Heather Adams. So as a senior in the social work department, we spend our senior year in a field placement, and mine is at a local health clinic. And what I noticed is that the documents that we give patients at the end of their appointment include this long document that is mostly health and weight loss tips. So with my interest in weight stigma in healthcare and my minor in rhetoric and public advocacy, I decided to take a rhetorical approach to analyzing these documents and start this research project. So I gathered documents from my agency and others in the area. So my data set also includes web pages that were recommended by providers, mostly from government websites. And after analyzing these documents and doing a literature review, I identified two major paradoxes. The first being the medicalization and wellness paradox. So what I'm seeing here is that the documents oscillate between the language of a medicalized model of obesity and more holistic wellness language. So the medicalized model is highly prescriptive and uses a lot of quantitative data like the patient's weight, their eating habits and movement habits, and tries to identify the medical approaches to solve those problems. Whereas the wellness language is trying to be more inclusive and saying that it's not a diet and that one's physical appearance of being overweight isn't necessarily the problem, and that one should just adopt healthy lifestyle practices and they will improve. The second paradox I'm identifying is the agency and destiny paradox. So what I'm seeing here is that the documents themselves are objects that sponsor agency. There include messages of how to change your lifestyle and how to eat better and move more. But at the same time, this agency is highly constrained due to the moralizing language that accompanies those health style recommendations. So it's saying that if you don't eat kale and take your child to therapy and do yoga, eat organic vegetables, then your morality is implicated and your judgments as parents and your character are all implicated. And what I'm seeing with these two is that they lead to my main finding that the documents are reflective of the prevalence of the medicalized BMI forward approach to body size, while at the same time including elements that are reflective of the cultural shift that we're seeing towards a reconsideration of the relationship between body size and health, and that the moralizing language seen in these documents is undercutting the potential to demedicalize. So the internal inconsistencies in these documents may hamper their effectiveness. And I also find that weight stigma persists in healthcare, even in this moment of change. So two areas to explore further would be the new American Association of Pediatrics Childhood Obesity Guidelines, and these new documents that I found that sort of flip the script. So these new documents are filled out by the patient and handed to the provider at the beginning of their interaction. And what they do is request that the patient be treated in a weight-inclusive approach and only be weighed for the purposes of dosage or anesthesia. So with these two areas of further inquiry, I'll conclude my presentation and thank you for listening.